Hi, welcome back to Advances in the Assessment and Management of Multiple Sclerosis, presented by Northwestern University Feinberg School of Medicine at NeuroSeries Live. You are tuned in to the final live session of today's program, entitled Strategies for Optimizing Function and Quality of Life in MS, with Dr. Patricia Coyle. My name is Dr. Stephen Krieger, and I'm an assistant professor of neurology at the Corrine Goldsmith Dickinson Center for MS. For those of you just joining us, I would like to remind you that today's session is a live, interactive program. It allows us to take questions in real time throughout the presentation. So I encourage you to send us your questions anytime by typing them in the box located at the lower left-hand side of your screen. So I'd now like to introduce our presenter, Dr. Patricia Coyle. Dr. Coyle is director of the MS Comprehensive Care Center of Stony Brook Neurosciences Institute. She is nationally and internationally known for her expertise in MS. Patricia, let's get started.
Thank you, Stephen. I'm delighted to be here. And in the next half hour, I'm going to be talking about strategies to improve function and quality of life in our MS patients with a focus on major symptom management. I'll begin with some background consideration and basics. I can't cover all of the MS symptoms in 30 minutes, but I've chosen some major ones, and then I'll summarize, including unmet needs, and then we can open it up for questions from the audience. Now, as everybody knows, MS is associated with a number of symptoms, and this doesn't spare any MS patient. The mild patient, the early patient, the late patient, the disabled patient, the progressive patient, the relapsing patient, all to a lesser or greater extent will have MS symptoms that need to be managed. These symptoms disrupt activities of daily living. They have a negative impact on the quality of life on our MS patients, and they're responsible for varying degrees of both mental and physical pain and suffering. So they become an extremely important aspect of MS that needs to be treated, that needs to be managed well. Now, every single symptom that an MS patient has can be improved. We may not be able to take the symptom away. It may be a very difficult symptom, but we can make it better, and that's why an organized treatment strategy becomes so important to us. And treating the MS symptoms is actually going to improve our MS patients' function and quality of life, so it's a very positive thing to do. It's interesting that a number of surveys have all found very similar findings. We undertreat a number of symptoms of MS. I'm not sure why. It may be because there are so many. It can be very easy to focus on the sexier disease-modifying therapy topic, but symptom management is really a nitty-gritty, very important concept in taking care of our MS patients. Now, one thing that I like to do from a very practical approach is have the patient write down in a list their order of the symptoms that bother them. Number 1, number 2, number 3. Why do I do this? Many MS patients will have multiple symptoms. I want the feedback. Which are the symptoms that they perceive as most bothersome, as really causing for them a poor quality of life? I may or may not modify that, but if I know what they consider number 1, number 2, that may very well influence my therapeutic approach to treat these multiple symptoms, because you typically can't do them all at once. You have to have an organized game plan. But it's interesting that symptoms may be linked. Depression, if you have fatigue and pain, you won't get optimum management of MS depression without also treating fatigue and pain, for example. I've also found even my brightest patients may often be in denial. They have symptoms, yet they're denying it. It's part of the disease. They don't want to admit it. And if you ask them, how are you doing? Is there anything wrong? They may very well tell you, no, nothing. But when you speak to the significant others, the spouses, the family members, you find out that there are significant symptoms that are disrupting their daily living. So I always like to speak to the other people in the family, and we'll often have someone besides the patient in the exam room there, provided, of course, the patient is agreeable to that. So what are the symptoms of MS? Bladder, bowel dysfunction, cognitive loss, depression, fatigue, walking abnormalities, pain and other sensory disturbances, paroxysmal attacks, sexual dysfunction, spasticity, tremor, visual symptoms. This is not even a complete list. I haven't mentioned dysarthria and difficulty with swallowing here, but these are a myriad of symptoms that many of our MS patients are going to experience, often multiple symptoms in the same patient. Now, I think in talking about optimum symptom management, keep in mind that there are different strategies that one can employ. It's not just writing a prescription. It may involve adjusting lifestyle and daily activities. It may be drug therapy. There may be physical and environmental modifications that you want to make to treat that symptom. There may be rehabilitation strategies, and occasionally even surgical or more invasive procedures. Or maybe it's going to be a multi-modality approach, and we'll come back to that concept. You really have to think thematically in these multiple domains in approaching an MS symptom. Before we get to the specific symptoms, I'd just like to make a general comment that I discuss with all of my MS patients now, because I think it's a treatment for all MS patients and improves their symptoms. And this is the concept of maximizing brain reserve, keeping our brain as healthy as possible as we all age, as we begin to lose function. How can we make it as healthy as possible so that it can respond well to a disease such as MS? This is the concept of regular physical exercise. That should be promoted in every single MS patient, at least 3 times a week for at least 30 minutes. Regular mental exercise and mental stimulation. Use it or lose it. This is a very important treatment to preserve and maximize brain function in all of our MS patients. Regular socialization. We do not want an isolated MS patient. That harms their brain, and I explain that and discuss that with patients and their family members. Control their vascular risk factors. So even though we're neurologists, we have to be cognizant if they're a smoker, if they abuse alcohol, if they have high blood pressure, if they have a poor diet, if they have hyperlipidemia. There's a responsibility to make sure that someone manages that, because that's hurting their brain and will hurt their MS and will really sabotage my best management of their MS symptoms. And really the concept of promoting a wellness program is key in MS. Now let's start with bladder issues. These are very, very common. Not so much early, but over time. And we can recognize neurogenic bladder as a major symptom of MS, and there are 3 different types. The main type of neurogenic bladder is the overactive bladder. The bladder muscle, the detrusor, will contract spontaneously with too small a volume of urine, and so you'll be urinating multiple times a day, urgency and frequency. This is the most common form of neurogenic bladder that we see in MS. Then there's a detrusor sphincter dyssynergia, a dysyoking, where the bladder contracts to expel urine, but the external sphincter muscle, instead of relaxing, clamps down and blocks the urine from coming out. That's not as common as the overactive bladder, but can also be seen. The ways to treat this are somewhat different. And then the rarest of the neurogenic bladder is the underactive bladder, where you get a big, boggy bladder, detrusor muscle, and you have dribbling or overflow incontinence. All MS patients' neurogenic bladder can be fit into one of these 3 types, and it's important to know. What are the symptoms of bladder problems in MS? Urgency, frequency, nocturia, dribbling, overflow incontinence, double voiding, and then the signs of what might be an infection that put the patient at risk: fever, chills, burning of the urine, change in urine color or odor, or lower back or flank pain, and then you are perhaps concerned about possibly getting a kidney infection. The goal of managing the bladder dysfunction in MS is to make sure you don't get involvement of the kidney, you don't get a pyelonephritis, you don't get upper tract involvement at all. Now, there have been a number of consensus statements that talk about the MS patient that has bladder issues. The first thing you do is rule out a urinary tract infection. Make sure they don't have a urinary tract infection. If you have an MS patient that is having recurrent urinary tract infections, they should be on vitamin C to acidify the urine. They should be on cranberry extract or cranberry juice, which has an independent effect in bringing down urinary tract infections. And sometimes, if it's frequent enough, they may need to be on a prophylactic daily